Hi, everyone. Thank you for joining this evening for the Pre-Health Integrative Medicine Club at ASU's Integrative Medicine Case Study Night. This event is basically a student competition where undergraduate and graduate students at ASU from all our campuses will be tackling a mock patient scenario with integrative medicine therapies that they've come up with. So, um, Before I start, I'll go over a small agenda of what we're going to be doing today. So first, I'll sort of summarize the case study that everyone's been working on, and then I will introduce our judges and our teams for today. Then we'll begin the student presentations. Each team will have 5 minutes to present, followed by a 2-minute Q&A for the judges to ask any questions they might have. Following that, we'll have a short deliberation period where the judges will pick our winners for today. And then finally, before we end today, we will announce the winners for today's case study night. So thank you all for coming. And first things first, I will start with a summary of our club first, for anyone who might be new to the club and wants to know more about us. So the PHIM Club at ASU has been around for a few years, and our main goal is to connect like-minded individuals who are pursuing either they're interested in careers in alternative medicine along with allopathic medicine, or they might be interested in integrative forms of wellness and just connecting pre-health students and integrative medicine enthusiasts who are looking to learn from both professionals in the field of medicine and wellness, and who are also looking to improve their overall well-being through community building activities such as this one, like the case study night. Again, we welcome in-person and online students from all the ASU campuses. So if you're already a member, thank you for joining. And if you aren't, you can visit our website, and we're also on Sandoval Central. So you can join us to receive event updates and participate in events like this. Um, okay, so next, to go over our case study for this event. Our mock patient scenario that the student teams will be tackling is focusing around a 30-year-old graduate student. So I'll sort of summarize what this patient scenario is. So a 30-year-old student, graduate student, presents with alternating constipation and diarrhea, abdominal bloating and cramping that worsens during periods of stress. Despite extensive medical testing, no structural or biochemical abnormalities have been found. This PhD student's chief complaint has been, my stomach has been acting up for months, and I think stress makes it worse. A short history of his present illness is patient X, which is his name, reports a 9-month history of fluctuating bowel habits, which alternate between constipation, 1 to 2 bowel movements per week, and diarrhea, 3 to 4 loose stools per day. His symptoms are accompanied by abdominal pain, bloating, and a sense of incomplete evacuation. He notes that his symptoms flare up before deadlines or presentations and improve during vacations. He denies blood and stool nocturnal symptoms or significant weight loss. A bit of background about patient X. He has long working hours in the lab with minimal exercise, eats irregularly, often skipping breakfast and eating late dinners. He is an omnivore, eats cafeteria food or takeout, has high caffeine intake and occasional alcohol use. His diet is generally low in fiber, fruits, and vegetables. He sleeps 5 to 6 hours every night, often interrupted by late night screen use. And as for his mental health, he reports anxiety, racing thoughts, and fatigue, no prior psychiatric diagnoses. For his medical workup, his colonoscopy is normal, stool culture is negative, celiac panel is negative, thyroid and metabolic panel are normal, and no food allergies detected. Finally, he has been diagnosed with irritable bowel syndrome with the mixed type IBS-M. So for our teams, their challenge was to design a holistic management plan for patient X. And before moving on to that, I will introduce our teams for today. So for our case study night, we are going to have 3 teams, and our team names are Pomsky, Wellness Warriors, and Flare Up Fighters. So for the teams, the main goals for the judging have been research on the condition, developing a care plan with at least 2 actionable treatment actions. From teams can choose from a various types of integrative medicine approaches and include this into their treatment while also being able to incorporate allopathic therapies into this. The teams must also define measurable outcomes, present evidence or rationale for each intervention using research, and supporting their points through peer-reviewed literature from journals, and also present, again today in front of you all, to the judges who are also here. So moving on to our judges, first of all, I would like for them to thank them for coming today and for judging and sharing their advice to all the teams today. So our first judge for today is Dr. Jessica Hogan, who's an assistant teaching professor at Arizona State University at the College of Health Solutions, and she is also our club's advisor. So thank you so much, Dr. Hogan, for coming, and a short bio about Dr. Hogan. So, Dr. Hogan, again, is a professor at ASU, and she also has a Doctor of Behavioral Health from ASU. She also has a Master of Science from Grand Canyon University in Industrial and Organizational Psychology and a Bachelor of Arts degree in Psychology and Spanish. Her research is focused on cross-cultural competencies of integrated behavioral health providers in China and Vietnam. Her research is aimed at indigenous-led health initiatives to improve health equity and health outcomes for Native American and Alaska Native populations. She has more than 10 years of experience teaching traditional, online, and blended learning courses in social psychology, health psychology, industrial and organizational psychology, management, organizational behavior, and healthcare leadership systems and delivery, health theory, social determinants of health, cultural diversity, health, and illness. Thank you so much, Dr. Hogan, for judging. And moving on to our next judge, Dr. J. Apte. Dr. J is a leading Ayurvedic practitioner in Texas at the DFW Ayurveda Center. Dr. J is one of the most experienced Ayurvedic Vaidyas or doctors in the US with more than 40 years of experience in Ayurvedic practice and teaching. She has an integrated degree in allopathic and Ayurvedic medicine from Pune University in India in 1973. In addition, she has a master's degree in pharmacology from the University of North Texas. Her sole focus is on providing the best Ayurvedic or holistic healthcare by bringing Eastern wisdom and Western knowledge together. She has given numerous talks on Ayurveda in many holistic conferences and IT companies. For the last 15 years, she offers a weekly Ayurvedic talk show on an Indian radio channel offering people healthy preventative tips. For the past 2 years, she has offered a free seminar series for seniors called Golden Health in Golden Years on Zoom. So thank you so much, Dr. J, for being our judge, one of our judges for today.
Thank you so much, Veena. And nice to meet Dr. Hogan.
Nice to meet you as well. I'm so
Thank
glad
you.
we're on this meeting together.
Yes,
It's a pleasure, an absolute honor.
me
Thank
too.
And before we get started, if the judges have any wishes or things for the teams before we get started.
No, I'm really looking forward to this, and I really admire Veena you for doing all this and all the students who are going to participate. And that's how you learn, from the practical examples. So I really encourage you to get involved in these kind of projects and learn more about health and wellness through different holistic modalities.
And I want to echo that. I can't congratulate Veena enough on her efforts and her tireless drive to promote our club and to promote both allopathic as well as complementary and alternative forms of medicine. So I'm very proud of her as the advisor of the club. She has spearheaded the promotion and development of this club this past fall. And thank you to all of the participants who are here today. We are very grateful for this opportunity to share how medicine has multiple lenses and to include the biopsychosocial model of health and to understand how to incorporate, again, both allopathic as well as alternative forms of medicine in this case model that you all will be presenting today. So looking forward to hearing from all of the teams.
Thank you so much. Yes, and before we get started, I would like to extend thanks to all the officers here for also being here and cheering the teams on. So thank you, Chrissy, Fatima, Lakshmi, for making this a great event. And without further delay, we will get started with our first team. So our first team is Pomsky. And if you guys are able to unmute, we can get started.
Hi.
Hello, everyone. Can you hear me?
Yes, we can hear you.
Okay, let me share. Okay. Can you guys see the slide?
Yep, we can.
Okay.
All right. So hello, everyone. My name is Houda, and my teammate is Olivia, and we're so happy to present for everyone the case study. The name that we chose is Stress Can Affect You More Than What You Think. Um, and go. All right. So the patient case, I think Vina already introduced it. I'm not going into deep into the symptoms, but I will give a little bit of a quick tour over. So for the abdominal pain, bloating, and a sense of incomplete evacuation, and obviously the tests that were done, we associated that with a functional GI disorder. Um, rather than a structural disease. We also established that the fact that his symptoms would worsen towards stressful periods and improve when he's relaxed say a lot that stress was a big factor of his IBS. And also, we think that big contributing factors to the stress was the high caffeine intake, poor diet, irregular meals, minimal exercise, and sleep deprivation.
Yeah, and upon doing more research on the condition, we found that in people who don't have IBS, their intestines contract and relax normally, while people with IBS, their muscles in the intestines spasm. And we saw that in his workup, there is no visible evidence of damage in the digestive tract, which is consistent with the IBS diagnosis. And so this patient has IBS-M, which means that he displays both constipation and diarrhea.
Yeah, so the next step here would be the care plan. We kind of divided our treatment components into two sections. The first one was the stress component factor. And we also divided that into two approaches to the main issue. The first one is going to be the naturopathic approach, which will mainly focus on mind, body, naturopathic ways. So upon research, it shows that stress directly impacts the gut-brain axis, increasing intestinal sensitivity and altering motility. For this reason, managing stress is a key therapeutic target in IBS. And according to an MC source, naturopathic strategies like mindful meditation, yoga, and relaxation breathing can significantly lower cortisol levels and improve digestion, which in our case would help a lot the patient. And also in the PMC review, it highlights the effectiveness of mind-body therapies and adaptogenic herbs like ashwagandha or chamomile, which naturally support stress adaptation and reduce IBS symptoms. If we go onto the osteopathic approach, our focus here is on the osteopathic management of stress in patients. We're gonna go with the osteopathic manipulative treatment, which is like a hands-on approach. And examples here would be the visceral manipulation. Oh, visceral manipulation, and myofascial release. I'm gonna go and let Olivia carry the rest.
Yeah, so our second treatment component after we manage the stress is to improve his main symptoms of diarrhea and constipation. And we can do that by slowly administering a soluble fiber, specifically psyllium husk, along with adequate hydration. So we would introduce a teaspoon at first, gradually increasing to the therapeutic range of 20 to 25 grams per day with at least 8 ounces of water. And to maintain hydration and minimize bloating, a recommendation of at least 500 mLs of water will help optimize results. We'll also introduce the feed regime, which means fiber supplement, elevation of feet, exercise of abdominal muscles, and drinking water on an empty stomach. So we'll ask the patient and show the patient different posture and movement exercises to promote natural bowel motility and to hopefully relieve those symptoms of bloating, constipation, and diarrhea.
Okay.
So when measuring the outcomes of the psyllium husk, symptom relief will be tracked using a weekly Bristol stool scale. This is a visual scale the patient can look at and record how his stool looks. And then the patient will also record the severity of his symptoms using a 0 to 10 scale, 0 being low severity and 10 being high severity.
When it comes to stress, measuring outcomes, we would definitely do the perceived stress scale and a heart rate variability during the day, probably 3 times a day. Just measure these two things. And also we would do a symptom tracking and lifestyle. And a third thing would be a regular follow-up evaluation. When it comes to the practices for yoga, meditation, hypnotherapy, or psychotherapy. I think we're
Yeah,
running.
so, oh, sorry.
Yeah.
So the key takeaway for the nutrition side is we're going to introduce the feed program, which is evidence-based, that in over 90% of patients with IBS, it reduced symptoms of diarrhea and constipation. And this is a patient-centered, realistic implementation. We recognize that he's very busy, and implementing these simple gradual changes is going to be more attainable for him. And the his outcomes will be measured and structured. The progress is tracked through the weekly Bristol stool scale, sorry, and a 0 to 10 symptom severity rating. This is a very clear, quantifiable assessment of the treatment effectiveness over time, and we'll be able to recommend in the future to hopefully change his diet, to decrease the takeout and caffeine and increase fruits and veggies, either via supplementation, but ideally through whole foods.
And thank you guys for watching. I think we went over the 5 minutes.
I'm sorry.
Yeah.
Thank you so much, Team Pomsky. And now I'll open it up to the judges if they have any questions.
Thank you for that great presentation. I thought it was wonderful to approach it from, multiple lenses. I do have a question about the prescribing or the protocol for yoga. And, it was mentioned, mindfulness-based types of approaches in yoga. If you were to encourage these types of practices, what would be your recommendation for the frequency or the number of yoga practices, whether it's per week or per day or per month for this particular case?
So when we were talking, me and Olivia, about this specific person that is very, very busy, and obviously stress comes from the fact that he was busy, we kind of said to each other, like, we don't want to overwhelm this person because they are already overwhelmed. I would definitely recommend it as in like once per week, or adapt it to what the patient would tell me is kind of realistic to him to do. And then I would just go from there. I don't have like a simplistic rule as in like once a week or twice, because I feel like it would depend from case to case. Um, yeah.
So, did you consider, yeah, Veena had mentioned that those episodes are worse when he has a presentation to give, and when he is on vacation, he feels so much better and all that. So, do you see any connection to stress and digestion and all that?
Yeah.
Um,
Oh, go ahead. Go
oh
ahead.
no, sorry. Yeah, definitely when he's in, I like to say like vacation mode, his digestive system is really relaxed. So I think we can ask ourselves, how can we add pieces of, his vacation mode into his real life? What brings him peace? What brings him happiness and relaxation that he can, bring into his daily routine? So I think that would be interesting to ask him,
Mhm.
this pretend patient. Yeah.
And I have one question. Do you think stress is causing constipation or constipation causing stress? What do you think?
I'll answer. What
Okay.
yeah, I think because we had the conversation about this specific question, and I told her that definitely the stress would was a bigger factor than nutrition. And I think she was advocating for nutrition, and that's how we partitioned actually our presentation. I do think stress is outrageously tremendous in our lives when it comes to anything within our like health. So that was my response, and I'll let Olivia.
Okay.
Yeah, no, I'd have to agree that the stress leads to constipation and diarrhea. Because I mean, we know that the vagus nerve is connected to the gut, and it has such a profound effect on our physiology. Um, so it's just really interesting how our mind, our reaction to the environment can lead to such dramatic changes in the body.
Mhm. Good.
Cool. Thank you, Team Pomsky. And we will now move on to our next team for this evening, which will be Wellness Warriors. So if you guys can
Thank you.
I
Hi,
will.
I'm Kylie, and then my partner is Brandon.
Randy.
Okay, can you guys see my screen?
Yes.
Hold on, before you all go, I want to remind you, make sure you put this on your resumes and or CVs as part of your contribution to higher education and part of your learning experience that you are presenting tonight. So make sure you are adding this, because it is, you all are doing a phenomenal job, but I want to make sure it's highlighted when you go for your interviews or for grad school. So that's my little 2 cents. Thank you.
All right, so we're the Wellness Warriors. Um, our title was Healing the Gut-Brain Connection, Integrative Care Plan for IBSM. And my partner is Kylie Heitmann. So the patient diagnosis, patient is a 30-year-old grad student with alternating constipation and diarrhea and abdominal pain as well as bloating and stress. His lifestyle includes lack of sleep, high caffeine intake, eats low in fiber, eats irregularly, minimal exercise, and the medical testing that was done were stools, colonoscopy, and cultures, which all came back normal, and reports no anxiety prior to diagnosis. So a little bit about the diagnosis itself. Irritable bowel syndrome is a group of symptoms that affect your digestive system. This one especially is known as irritable syndrome mixed type M, which is a subtype of the bigger group, and it is characterized by periods of constipation and diarrhea, as well as hard and lumpy bowel movements. Symptoms experienced include abdominal pain, cramps, and the exact cause of IBSM is unknown, but symptoms do get exacerbated by stress, diet, and hormonal changes.
So we have a care plan, and these treatment plans are recommended for 3 months, but if the symptoms improve, it's suggested to continue. Our first treatment option one is nutrition. The treatment action was a dietitian guided FODMAP elimination and taking probiotics. So FODMAP is reducing certain carbohydrates that are difficult for the body to digest. The low food map diet allows the body to temporarily restrict these carbohydrates and gives your digestive system a rest. And that includes oligosaccharides, disaccharides, which is like the sugar and dairy products, monosaccharides, and then polyols. So that will help benefit that. And then probiotics such as eating yogurt or taking Bifidobacterium lactis, and that supports digestive health and function. Bifidobacterium lactis is a naturally occurring gut microbe found in mammals, including humans, and can promote digestive comfort. It as well, clinical trials show that supplementation with this can improve stool regularity, abdominal pain, and bloating in patients with IBS. And then meta-analysis support that specific probiotic strains, including B. lactis, modestly reduce global IBS symptom scores compared to the placebo though responses vary by individual. And then we also said limiting the caffeine intake and creating a more consistent meal schedule, eating breakfast, lunch, and dinner, and home cooked meals. I know he works long hours at the lab, so whether it's eating before he goes to work and then taking his lunch break, and then once he gets home, eating dinner, but having more of a consistent time and schedule that he is eating.
So treatment plan two was a behavioral plan, and behavioral therapies like cognitive behavioral therapies can reduce symptoms by teaching coping mechanisms, managing stress, and improving mental health. Yoga may help with irritable bowel syndrome by reducing symptoms like anxiety and improving quality of life. Works by targeting the brain gut axis through poses, breathing exercises, and meditation, which all tend to reduce stress and calm the nervous system. Recent studies have also shown that mindfulness-based cognitive therapy adapted for IBS showed reduction in IBS symptoms and improvement in overall quality of life.
Then treatment three was exercise. The treatment action specifically was resistance exercise. Resistant exercise as a treatment plan contributes to gut health through its effect on the gut barrier function. Resistance training is known to support overall health, muscle strength, metabolism, body composition, which can indirectly benefit IBS via better general health and stress resilience and metabolic regulation factors that often influence gut infection. Enhancing the integrity of the gut barrier through resistance exercise could therefore be a key mechanism by which this form of exercise benefits gut health. And then that includes resistant exercise includes dumbbells, barbells, kettlebells, resistant bands, body weight exercises, and then doing like squats with your body weight and stuff like that.
So measuring outcomes, the patient's progress on the treatment plan could be monitored by various things such as a Bupa symptom diary, which is a record keeping tool, often a downloadable PDF or app that helps users track symptoms and potential triggers like food, mood, or exercise to better understand their health and share detailed information with the doctor. These diaries are especially helpful for conditions like IBS, endometriosis, or general pain, allowing for the identification of patterns and aiding in a more accurate diagnosis and treatment plan.
And then the conclusion we had was irritable bowel syndrome is characterized by alternating episodes of constipation and diarrhea. Some common symptoms include abdominal pain, bloating, and change in bowel habits. Some causes of irritable bowel syndromes are unknown, but it is believed to involve factors such as abnormal gut mobility, heightened sensitivity to pain, disruption in the communication pathway between the gut and the brain, and as well as diet and stress and other things like that. And then treatment plans that are recommended for irritable bowel syndrome include a rich fiber diet, probiotics, therapy, mindfulness, and exercise, and then some therapy as well. And then those are our references. Thank you for listening.
Thank you, Team Wellness Warriors. And now for the judges, if they have any questions.
I have one question.
Yeah.
Do you think that drinking some water, do you know these so busy students and all, they even forget to drink. And for the body to move regularly and all, some hydration also is very, very important. So another thing also is important is what kind of foods does he eat? Is there enough fat also? We always blame that fat is bad, but some amount of fat also is essential for the body to function better and all that. But I liked your approach of nutrition first and all that. And then you took care of his emotional thing also. So good job.
Thank you.
Yeah, thank you for all of that. That was very comprehensive. I have a couple questions regarding the FOB map, and so how you would, necessarily map this out, and what you would prescribe or encourage regarding caffeine intake per day. And also regarding the yoga, if you are going to prescribe this or encourage this, what would be the number, the type, or the frequency of the yoga that's being prescribed? So, for instance, Kundalini yoga is quite different than if I'm going to join my local core power yoga and do even weights in yoga. So, like, there's, all different types of yoga. And so I'm wondering, if, what that might look like. And then one other thing that kind of stuck out to me was the use of kettlebells, especially with a sedentary adult, and how prescribing that could be seen as contraindicated, and how you could, rationalize that type of approach.
So for the yoga and then the exercise portion, I think that you could use them both together. Like they kind of work hand in hand. You can do yoga with some weight resisting tools like dumbbells and stuff like that and incorporate it into your yoga. And I would encourage it. I mean, he's working long hours in the lab, but to be able to get better in a way per se, you have to be willing to make that opportunity to sacrifice some things, like trying to explain this in a better way. So I think that doing it when he gets home, like before or after he eats dinner, and kind of setting a consistent schedule with it along with eating on a consistent schedule, I think will be beneficial for getting his gut health a little bit better. I think Brandon might be able to elaborate a little more.
Well, let's first start off with all the way back with the caffeine intake. Lowering caffeine intake will be most beneficial to patient X, as high levels of caffeine tend to affect the gut pretty drastically. So finding alternative sources.
So my question would be like, can we define that? So how do we
So
make
maybe
that?
like, let's say patient X drinks 3 cups of caffeine a day, morning, lunch, and evening. We can reduce it to 1 cup a day. And eating foods that are rich in fiber also help out the gut. And in terms of exercises and stuff like that, just showing research to patient X, showing conclusive research to patient X that resistant workouts tend to improve overall quality of life by reducing stress, and um, it's just the overall environment of just like creating a new habit and learning, and just with sense of relief might help patient X out in managing stress as he goes through his school. And yoga practices involves a lot of breath work, which he might implement back into his schoolwork, just learning how to breathe better, which may allow him to navigate stress. And back to the exercises and workout thing, it helps out with abdominals, and which may strengthen just abdominal walls, and with that help out his whole overall like digestive system as well. So yeah.
And then the FODMAP, it's beneficial to eliminate certain things or lower your intake of it. Like wheat can cause huge flare-ups for some people. The gluten, dairy is a main one too. I know nuts too also can cause flare-ups for some people. And like sugar alcohols, I think would be beneficial, and kind of replacing it with more fruits and vegetables, because he had kind of had a low fiber diet and not as much vegetable intake and fruit intake. So upping that would definitely help. And then kind of going off of Brandon, how he said limiting from 3 cups of coffee or energy drinks or whatever a day, replacing it with water, because it kind of helps you keep going throughout the day. So that will also help improve his stamina with going to work, because stressful work is stressful sometimes, especially working in a lab. You kind of have a lot of responsibility. So that can also help you go through your shift easier and smoother. So it's not as stressful as it normally would be.
Thank you for that. As Dr. Apte talked about, the hydration is key, right? Adequate water intake helps support, cellular digestion and growth and repair, and it is necessary for all metabolic processes, to maintain, not just adequate hydration, but adequate sodium, potassium levels, and all of those things that are, the result of proper hydration. And so I appreciate you, giving that, some, attention.
And I also liked that you mentioned about eating at kind of right time and intervals and all. That is very, very important, because unfortunately we don't have a routine for anything. We eat anytime, we exercise anytime, and all those kind of things, and that causes a lot of problem. So eating at right times and all, that makes a lot of difference and makes sense. So good job.
Yeah, and it's important too to keep your diet well while you're doing that too.
Yes.
Just
Yes.
because if you don't, it's kind of contradicting getting on a correct schedule too. So,
And he also has a diet like just high, switching up his diet as well. Switching up his diet as well might help him out, because he tends to eat like a high fast food, like fatty diet. So switching that out might help him relieve some of the stress and inflammation that's caused by that.
Perfect. Thank you, Team Wellness Warriors. And now moving on to our final team for today, which is Flare Up Fighters.
Mm. All right, you guys able to see my presentation?
Yep.
Okay. Hello, everybody. We are the Flare Up Fighters. Specifically, we will be going over When the Gut Speaks, navigating IBS through mindful science. As we previously discussed, patient X is a 30-year-old PhD student with unremarkable past medical history. He's had 9 months of alternating constipation and diarrhea, with abdominal pain, bloating, that worsened with stress. Incidentally, he has a sedentary lifestyle combined with poor nutrition and sleep hygiene. Ultimately, after normal test results, he was diagnosed with irritable bowel syndrome mixed type, which is a functional gut disorder that affects the brain and how the brain and digestive system communicate. Meyer and Tillish have described that although there is no visible intestinal damage, the gut's nerves can become overly sensitive, especially during stress, which alters bowel movements and increases discomfort. Go. In China, IBS is often treated with a combination of diet adjustments, probiotics, traditional Chinese medicine, and stress management techniques that help the gut function more smoothly and improve a quality of life. For the next 3 months, patient X's plan will focus on the following: a structured low FODMAP diet, slowly reintroducing foods that are well tolerated and taking probiotics regularly. Mindfulness and other stress reduction strategies will also be included to help calm the gut's response to stress. We will also focus on maintaining consistent sleep patterns and regular meal timing to support digestion and reduce the likelihood of symptom flare-ups. For the first 4 to 6 weeks, we are going to ask the patient to limit high FODMAP foods like onions, garlic, beans, apples, and wheat. After that, we will slowly reintroduce foods one at a time to see which ones might trigger symptoms. We also want to add more soluble fiber like oats, chia, or psyllium, and include probiotic-rich foods such as yogurt or kefir to help support gut health. Low FODMAP diets help reduce gas and bloating by limiting certain fermentable carbohydrates that are poorly absorbed in the small intestine. Probiotics, on the other hand, can help restore a healthy balance of gut microbes, improve digestion, and may reduce bloating and abdominal pain in IBS patients. Additionally, several low FODMAP choices can be prepared overnight or incorporated into quick grab-and-go meals, ensuring that dietary changes do not become an undue burden on the patient during deadline periods. To keep track, the patient will use a simple stool and symptom diary each week so that we can see patterns and improvements. On the behavioral side, we recommend daily mindfulness or guided breathing. We also recommend cognitive behavioral therapy tailored for IBS. It can help them rethink about how they approach food. In addition, when stress levels go down, the gut tends to react less strongly, so there's less cramping, bloating, and fewer flare-ups. These approaches can help the brain and gut communicate better. And in addition, we recommend them seeking support both from university academic advisors as well as their lab advisors. And then track stress and symptoms daily with quick check-ins and using the perceived stress scale.
Let's move on to stress management. Managing IBS is not just about diet, it's also about managing stress, which plays a major role in how the gut responds. In a high pressure setting like a lab, stress can easily trigger or worsen symptoms. So research supports this connection. For example, the Progress program, which is a mindfulness-based stress in reduction initiative, help participants lower stress, anxiety, and depressions while improving attention and the focus. Similarly, the strategic management program designed for university students led to better emotional regulation and less anxiety, which would be the outcomes that could directly benefit our patients' daily routines. So for our patients, simple changes can make a difference. taking short mindfulness break between experiment, using time management tools to organize lab tasks, and creating a consistent daily routine to prevent burnout. So these practical steps can reduce stress and in return help make IBS symptom easier to manage. Now let's talk about lifestyle and sleep. The patient should aim for about 7 to 8 hours of sleep each night. Limit caffeine to no more than 2 cups a day, and try light exercises such as 20 to 30 minutes work 3 to 4 times a week. Improving sleep quality is just important as diet. So something as simple as limiting screen time before bed, dimming lights, and keeping a regular sleep schedule can really improve rest and digestion. We also recommend trying a sleep log to track bedtime, total sleep, and morning energy. This can help identify patterns and build a routine that support better gut health. To wrap up, managing IBS is not about perfections, it is about progress. The student shouldn't need to apply everything at once. Instead, small, consistent habit like practicing mindfulness, maintaining healthy sleep, and using time management strategy can make symptoms more manageable and improve overall well-being. Success for this patient is not about full compliance, but about seeing fewer flare-ups, feeling more energized, and building a balanced lifestyle that support both health and academic goals. Thank you.
Thank you, Flare Up Fighters. And now for the judges, if they have any questions.
I like your presentation, and you considered both nutrition and the stress management and all. So, and you, one more thing you added was lifestyle, which is very, very critical. So having the right time to sleep, having right time to eat, having being right time to exercise and all that makes a lot of difference in our health. So instead of just focusing on the disease, if we focus more on health and lifestyle practices, we will be able to solve many of these issues.
Yeah,
Good
and
job.
I want to echo that. I mean, one thing you said was improving sleep quality is just as important as diet.
Yeah.
And as we know, diet and sleep are two of the core pillars of lifestyle medicine. And so Dr. Apte, hit it right on the head, right? The inclusion of lifestyle practices and a comprehensive view of, behavior modification within those distinct pillars is going to improve health and longevity, as well as, the day-to-day things that this patient is presenting with. I do have, like, I've kind of, it seems to be kind of a reoccurring thing, that each each group has presented with is, the inclusion of CBT and mind body practices and mindfulness and yoga, but I'm not clearly understanding what would be like, if it were me, what would you say to me? You say, oh, go do mind body exercises, go do yoga, right? I mean, so for all of the groups, I see that as kind of a blanketed approach to, understanding how our minds and our bodies are connected. And so for all of the groups, I didn't see a natural prescribing or an understanding of what types of yoga or the number, the frequency, getting a little bit more in depth with that would help patients understand what you exactly are trying to tell them to do. So if you say to somebody who's never done yoga, well, go do yoga, right? You can do it at home, you can do it, after work or before work when you come home from the lab, like that seems somewhat foreign to them. Um, and so, like I said, for all groups, understanding what that is exactly that you're telling people to do or why, we know that yoga and mindfulness is beneficial, right? We're all understanding of this, like, this holistic picture of health. But to the everyday person, they don't know what that means. And so translating that science is so critical for all of the groups to understand how exactly we will do this in clinical practice. What you would say to a person, how often, what types of yoga, what would you recommend them doing? Is it 10 minutes in the morning before they go to lab? Is it, 20 minutes before they go to bed? Is it in the middle of the day when they take their lunch break and they can go to a park? Kind of try to paint this picture and like story tell and like, really share, what it would look like for them, because when people can envision themselves doing something, they're more likely to do it. They go, oh, I can totally see myself doing that. I'm going to do that. And so that's where the behavior change is going to come from. And so it's not just for your group, but it's for all the groups to clearly understand how behavior change in clinical practice is really difficult for most modern Americans and for most modern people to do, to put into practice, to change behaviors that they've been doing for 10, 20, 30, 40 years, right? Adding more fruits and vegetables. They're like, well, I eat fast food all the time. What do you mean adding more fruits and vegetables? How do I even do that? Right. And so for many of us, we've been doing these practices for a really long time, and we just understand, okay, if I add 2 more fruits and vegetables every day, I'm going to be healthier. But a lot of people, right, because they're restricted by access, they don't have the ability to get fresh fruits and vegetables, or they don't know how to incorporate into their diet. We as providers, as practitioners, have to kind of paint that picture of what it looks like for them in order for them to envision it and for them to go, oh, I can do that. I can incorporate that into my daily practice. I'm in the office or I'm in the lab 10 hours a day, but I can take 10 minutes here or I can log my food. And so I really appreciate your group, as well as all of the groups, sharing their information and, um, the mind body approach, as well as those behaviors that are so critical with improving health outcomes, right? And as Dr. Apte talked about, right, it's about lifestyle, right? Lifestyle is the medicine. Right. But we're just now in westernized medicine understanding that, or being able to actually have a CPT code or be able to bill for that. Right. We couldn't bill for it before because there was no code, to be able to bill for that particular service. Um, and so one other thing for your group, and then we're going to finish, is that I love that you incorporated a more holistic social approach with checking in with their advisors, right? Checking in with their mentors, checking in with their lifelines within the college community, within the higher like academic community is so critical, because we know advisors, we know mentors can make or break the academic success of these individuals. And so I love that you included that in your presentation. So great
And I
job.
actually have an answer for you on the types of yoga if you'd love to hear it.
Okay, yes.
So in general, we would recommend, if at all possible for the student, because they are in the lab a lot, 1 to 2 times a week to try and do either hatha, or I might be pronouncing that wrong, hatha or restorative yoga, mainly because they focus on relaxation poses, breathing techniques, and we feel like that would be really helpful, especially considering the levels of stress that the student goes under. However, we do recognize that that may not be feasible. And so while we recommend that they try it out, we understand that it might not be something that they can incorporate into their lifestyle at this time. We would also recommend seeing if the university offers any classes for students to try as like beginner classes. And maybe that's something that could fit with their schedule a little bit better, considering that they are most likely on campus for a majority of their time during the day.
Very smart. Very smart. I love that, right? Utilize the resources that are in your own backyard. And so if you're regularly on campus, if you have access to the fitness center, if you have access to yoga classes, and you're not having to pay extra dollars and to, commute across campus or to get somewhere else in order to put, therapeutic practices into your daily routine. That makes it much more likely to do that. One of the best ways to, encourage people to do something is to just make it easier for them. And so how do we make it easier for people, right? We create social structures and we create avenues that are going to make those practices easier. And one way is, the fitness centers and the gyms that are on campus. And so you don't actually have to leave in order to go and to practice or to utilize, a weight training, class or to, do certain things that are going to be therapeutic. They're already, in this, higher education kind of bubble that you're already part of. So really good.
Thank you. So thank you, Flare Up Fighters, for that. And that was our final presentation for today's case study night. So what we will do now is we'll go into like a short 10-minute deliberation for the judges so that they can select the winners of the case study night. But before that, Fatima, our vice president, will be in the main room, so everyone can stay in here, and approximately like after 10 minutes, once the judges are done, we'll be back. But Fatima will be in here to answer any questions you might have about like what this club is if you're new, and then any upcoming events we do have, because we have some in November. So she'll be here to answer any questions, and we will be back in around 10 minutes. Okay, welcome back, everyone. And I will now share our winners for today. So before I announce, thank you all for first, thank you to the teams for signing up and spending your time to tackle this mock patient scenario and joining this learning experience that we've tried to facilitate here at the PHIM Club. So thank you all for participating. I'd also like to thank our judges, Dr. Hogan and Dr. J, for judging our teams today. And also thank you to all my officers, Fatima, our Vice President, Chrissy, our historian, Lakshmi, our Community Outreach Officer, for helping coordinate these events. And also thank you to the audience for being here today and cheering the teams on. So without further delay, if I could get a virtual drum roll, and I don't know how we could do that, but drum roll. Our first place goes to Flare Up Fighters.
Yeah.
Congratulations. And for second place, we will have Wellness Warriors.
Yay.
And third place is for Pomsky.
Yeah.
Congratulations, teams. And now for the judges to share their final words about feedback and anything else they had.
Okay, as Veena mentioned to you, I'm an Ayurvedic doctor, and Ayurveda is a science from India, like a Chinese medicine is from China. Ayurveda is from India. And this is typical case where people have a lot of issues with digestive system, but mainly the constipation and all that. So I just want to give you one scenario. Suppose you are watering your backyard plants, okay? And on one side, the water is coming in the pipe and the other nozzle is not open. What will happen to that pipe? It will become so rigid because water is there, but it's not coming out, right? And the moment you open the nozzle, all the pressure is gone and water is flowing in and out and all that. That's exactly should happen in our digestive system, that we eat from one end, the other end has to be completely open. So the bowel movement is the very, very critical thing for having proper digestion and all that. So you all mentioned about the nutrition and exercise and all that. I always look at all these kind of cases is first is the take care of the constipation, because once the constipation is gone, even mentally you feel so relaxed. Let me give you another example. Suppose you are on the highway and there is an accident. And what happens? All the cars are stuck and everybody's built so much pressure. And the moment the cars, they remove the cars which are had the accident, and all the highways open up and you feel better emotionally, physically, and all that. So the stress level also increases a lot when he gets constipated more. And he mentioned that when he has a presentation to give or the deadlines, he feels more constipated, and when he is on vacation he feels better and all that. So mind and body is definitely connected, both go hand in hand. So it is very important to take care of that, and for that nutrition is important, hydration is very important, and eating at right time. And that's what I want to mention. The new branch has opened, like lifestyle medicine. That lifestyle is kind of the doing the right thing at the right time. Suppose you have a project to, like tonight's project. If you complete it tomorrow or day after, it's no use. You have to submit it on time. Same way, if you have a flight to catch to maybe New York and the flight is at 6 o'clock, you went to the airport at 8 o'clock, no use. You have to be, everything has to be on time. So that's why if you follow that routine, getting up at certain time, going to bed at certain time, eating at right time, exercising at right time, you will see tremendous improvement in your mental being and your physical condition and all that. So lifestyle science or lifestyle medicine has a lot to do with our health. So great job, guys. You did wonderful. You were on the right track. And if you want to know more about Ayurveda, let me know.
Well, thank you so much, Dr. Apte. That was phenomenal. Your analogies and the visualization of being stopped on the road, or, getting to the airport 2 hours late, right? We can envision those,
Yes.
right? And that's why timing is so critical,
Yeah.
right? And as a doctor of behavioral health, as an Indigenous woman, as a professor of lifestyle medicine, I cannot share with you how time and place and understanding when to do things and why to do things is so important.
Yeah.
And again, I want to reiterate that lifestyle is the medicine,
Yes.
not the pharmaceutical. It's not the operation. It is not all of these other things that are just going to have specific, biomedical influence. It is the psychosocial impact that is also very, very critical, right? And the social factors that influence health, the social drivers, the social determinants of health, clearly are outlined in this case, right? With the work, the PhD student, the hours at the office, the hours in the lab, those are social factors, right? And so understanding how to mitigate those social factors and integrate specific timed approaches, right? How many days a week should I go to yoga, or what should I do before work or after work, right? When do I need to eat? Oh, well, maybe I need to set a timer of, I have to have a snack here. I have to have breakfast here. I have to have lunch here, right? And then I'm not going to snack at night, and I'm not going to wake up to get on my phone. Right? All of those approaches are social approaches, are behavioral approaches within the social system. And so understanding that when we are talking to patients, when we are prescribing, when we are in a clinical setting, that we understand these nuances that people have to work through and go through just to do life makes us a more trusted provider, makes us more receptive, and they're more willing to take our advice and go, oh, I remember what they said. I'm going to put that into practice. You know what? I'm going to look up and see what kinds of yoga are on my campus and how I can fit that into my schedule. You know what? I think I'm going to actually like make my lunch tomorrow. I'm going to bring a water bottle to my lab, right? Implementing these small behavioral changes will have a significant impact on not just individual health, but overall population level health. So, thank you again for everyone. I know we are past the time, but this has been such an incredible experience, and we are so grateful to all of our members of our club, as well as all of the leadership of the club, to our judges, and to our participants, and to the team members. Again, thank you so much. And we will stay on if you have any additional questions, if you want any contact information. I will stay on for a few more minutes if you have any additional questions for me, or for Veena. If you have to head out, we totally understand that as well. Thank you for your time. This has been great. So thank you.
Yes.
Thank you so much, Dr. Hogan. Thank you so much, Veena. And congratulations to all the participants. You did great job. Good night.
Yes, thank you so much, Dr. J and Dr. Hogan.
Yeah.
And thank you to the teams. And I will be on here for